Case 1. A patient has unresolved issues with his father and becomes upset when his psychiatrist cancels an appointment, believing the psychiatrist is not interested in him. This is an example of transference. Transference is the unconscious shifting of emotions or expectations from past relationships onto a person in the present, often originating from early relationships with parents. Case 2. Frontotemporal dementia is characterized by aggregation of tau protein and other protein inclusions, along with early neuronal loss in the frontal and temporal lobes. In contrast, Alzheimer's disease involves early neuronal loss in the parietal and temporal lobes, with neurofibrillary tangles and amyloid plaques. Patients with frontotemporal dementia have impaired executive function and poor work performance. It is an early-onset dementia characterized by prominent behavioral changes. These include disinhibition, apathy, loss of empathy, and impaired social relationships. Patients may develop hyperorality and changes in diet, often with a preference for sweets. Severe cases may include binge eating and compulsive behaviors such as repetitive speech, hoarding, or adopting new rigid behaviors. Case 3. Certain medications increase the effect of methadone, including fluconazole, voriconazole, ketoconazole, ciprofloxacin, clarithromycin, cimetidine, and fluvoxamine. Methadone can cause overdose characterized by somnolence, pinpoint pupils, and respiratory depression. It can also prolong the quart interval and increase the risk of dangerous arrhythmias. For example, fluconazole can increase methadone levels and lead to overdose. Case 4. A patient with alcohol withdrawal presents with agitation, disorientation, tremors, hypertension, and tachycardia after a period of abstinence. Alcohol withdrawal occurs due to decreased inhibitory activity and increased excitatory activity in the brain. Chronic alcohol use reduces gamma-aminobutyric acid receptor activity and increases glutamate receptor activity. When alcohol is stopped suddenly, this leads to central nervous system overexcitation. The key mechanism is increased activity of glutamate receptors. Chronic alcohol use decreases inhibitory receptor activity and increases excitatory receptor activity. Sudden cessation leads to decreased inhibition and increased excitation, resulting in symptoms such as agitation, disorientation, tremors, and autonomic instability. Psychotic disorders. Case 5. Brief psychotic disorder lasts at least 1 day but less than 1 month, with sudden onset and full recovery. Schizophreniform disorder lasts at least 1 month but less than 6 months, with symptoms similar to schizophrenia but without requiring functional decline. Schizophrenia lasts at least 6 months and includes at least 1 month of active symptoms, with functional decline. Schizoaffective disorder includes both mood symptoms and psychotic symptoms, with at least 2 weeks of psychosis without mood symptoms. Delusional disorder involves at least 1 delusion for 1 month or more, without other psychotic symptoms and with relatively preserved functioning. Case 6. A patient presents with lethargy, poor coordination, slurred speech, and rapid improvement, along with a rash around the mouth and nose. This presentation suggests inhalant use. Inhalants include substances such as glue, toluene, nitrous oxide, amyl nitrite, and spray paints. They are commonly used by adolescents because they are inexpensive and easily available. They are inhaled through cloths, bags, or direct sniffing. They act rapidly on the central nervous system and cause short episodes of euphoria, lethargy, disorientation, and impaired coordination. Effects usually last between 15 and 45 minutes. Case 7. A patient has difficulty with writing but not with reading or mathematics, and this causes anxiety. This is consistent with a specific learning disorder affecting writing. Learning disorders involve difficulties in key academic skills such as reading, writing, or mathematics, resulting in performance below expectations for age. Case 8. A patient treated with monoamine oxidase inhibitors for depression needs to switch to a selective serotonin reuptake inhibitor. A 2-week washout period is required after stopping the first medication before starting the new one. This prevents serotonin syndrome and allows enzyme activity to recover. Case 9. A patient receives haloperidol and develops abnormal facial movements and tongue protrusion shortly after. This is an acute dystonic reaction. It is caused by dopamine receptor blockade in the brain and presents with sudden involuntary muscle contractions. Examples include facial grimacing, neck spasms, upward eye deviation, and severe muscle rigidity. Treatment includes anticholinergic medications such as diphenhydramine or benztropine. Second-generation antipsychotics are commonly used as first-line treatment for schizophrenia because they have a lower risk of movement disorders. However, they are associated with weight gain and metabolic complications, including diabetes. Olanzapine and clozapine have the highest risk of these side effects.